Morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So as we know, we are discussing about the case scenarios of different cases of cough. So today we will have another case regarding cough, and this particular case will going to help us to develop an approach towards different causes of cough and to diagnose a case very properly so that the right treatment can be given. Now, this is a case. A 2-year-old child present with a fever and cough for 6 days. And child has got fever and as well as cough since last six days. The total duration of the illness is about 6 days. And what the mother says is fever is slowly increasing day by day. On the first day fever was little less, and now gradually the intensity of the fever is increasing. And the meantime child is also irritative and it is not taking the feed properly. This is a complaint of the mother. And child used to close the eyes most of the time of the day. This is one more important. हमेशा सोता रहता है. ठीक है. Child used to close the eyes most of the time of the day. 2-year-old child. Okay. And some nasal obstruction is also there. According to mother, some nasal obstruction is also there. Some sound is coming. And some medications was given for 7 days. And 6 days the child was having all these problems since last 6 days. And since last 6 days itself, some of the medications were given. And some medications were given for the last 6 or 7 days. And now the fever and nasal obstruction is reduced. This is what mother says. And but cough is there. Fever and nasal obstruction is reduced to some extent. And according to mother, there is also the history of atopy in the family. Yes, in the family also there is some history of allergy is there. And there is also a history of snoring and as well as mouth breathing. There is also the history of snoring. So mother says child karate leta hai, or snoring is there. And mouth breathing, he used to open the mouth during the night hours when he is sleeping. So mouth breathing is there. So patient also gives a history of such repeated attacks. So child is having such repeated attacks since the birth itself. This is a complaint of the mother. And at presently child is 80 centimeter for 2 year. 80 centimeter is not bad. Okay. Not too less. Weight is 9 kg. Weight is little less, and not little less. Considerably it is less. Anyway, we will see what actually this is a case. So this is a case. 2-year-old child present with the fever and cough since last 6 days. Presently, because of the medication, fever and as well as nasal obstruction were relieved. The cough is there, and family history is present, and snoring history is present. Mouth breathing is present. Then such repeated attacks, that history is also there. Okay, and during that course of 6 days, child was little irritative and also not taking the feed, and anthropometry is affected to some extent. Now let us see the analysis of this particular case. Now, we know that the predominant symptom in this case is fever and as well as cough, both, isn't it? Because mother has given the main complaint as fever and cough both. So both are the main complaints. According to mother, both are more disturbing. Okay, so fever and cough both. So fever is indicative of infection. Okay. Fever is usually indicative of infection. That infection may be now again the viral or it may be bacterial. But if it is bacterial, we know that it causes a localized problem, and if it is viral, it causes the generalized problem like cough, cold, fever, etc. will be there. Now this is one point, because fever and cough both started at a time. Now if the fever started later and cough started earlier, we can say this is a case of allergy. Okay. But here it is not like that. Fever and cough started at a time. Okay. Now, to say that it is a viral, to say that it is allergic, cough should be more severe, and fever should be mild or moderate or start later. But that is also not the case. To say that it is a bacterial infection, then fever should go on increasing day by day. That history is there. If you look into the history, fever gradually increases, she says that, and child is also irritative and child is not also taking feed. So this may be suggestive of that is dull child or sick child, maybe point towards that. So it may be bacterial, but bacterial should cause a localized infection. But here fever, cough, and nasal obstruction is also there. So to some extent, we can say that mm, this may be bacterial also. Quite confusing. Okay, and to some extent, we can say that this is viral also. So now, if you look into the past history, we'll go one by one. If you look into the past history present. In the past history, there is frequent cough and cold is there. Okay, past history, mother, recurrent respiratory tract infections are there. Now, if there is recurrent respiratory tract infections are there, then main focus goes to either viral or allergic, because usually bacteria will not cause the recurrent infections unless and until child is having some immunological problem, immunosuppressive or immunocompromised state of the child, or some anatomical deformities of the child, or some congenital defects of the child. Then only there will be repeated respiratory tract infection by the bacteria. Okay, so repeated respiratory infection is there. And then look into the family history. If you look into the family history, yes, family history of atopy is also present. So now again the allergy cause is coming to the main differential diagnosis. Because family history is there, the family history of atopy is there, so allergic may be. Now, the frequent cough and cold is usually divided into two groups. Now, to understand this particular dilemma of this particular case, frequent cough and cold when it is coming, then actually it is divided into two groups, one with fever and another without fever. Okay, so this case, so when such cases are coming, so usually we have to divide the particular condition into two ways: frequent cough and cold coming with fever or without fever. If it is without fever, mostly it is allergic. If it is with fever, maybe it is viral, or maybe it is bacterial, or maybe some other causes. Okay, but in this case, it is with fever. In the beginning itself, it is started with the fever. It is not that fever started later. Allergic, usually either fever is absent or fever starts in the later part in the mild way. Now, so decide whether the fever which is coming here along with the cough, whether it's a viral or bacterial. And if it is viral, then in the viral fever we have got a set pattern: interfebrile period, the rhythm of the fever, then fever gradually increase the first 2 days, then start gradually decreasing. Fever respond very well for the antipyretics. Okay, interfebrile period is very playful. So like that, we have got 5 questions that has to be asked in all the viral fevers. If it is not seen, then definitely it is a bacterial fever. Okay, in the bacterial fever, interfebrile period is dull, rhythm is maintained, onset may be acute, fever goes on increasing as the day increases. Okay, and as the days increase, many more symptoms will appear. In the beginning, there is no symptoms, but as the days increases, the localization starts and more symptoms appear. So like this, we have to differentiate between bacteria and viral fever. So let us see what happens in this case. In this case, the history of snoring is also there, and also mouth breathing is there. So history of snoring and mouth breathing is there. So that suggests there is some problem with the tonsils, or there may be some problems with the adenoids. There is a background disease is there, some background disease there. So recurrent bacterial infections may be expected, because whenever there is, I told, recurrent bacterial infections are either present in the immunocompromised state, or some of the anatomical problems, or some of the congenital problems. So this is one of the anatomical problem where the adenoid is present. So this becomes a background cause. So whenever such background causes are there, bacterial infections can occur repeatedly. Okay, so here history of snoring and as well as mouth breathing is there. So it is a recurrent bacterial infection due to background cause like adenoids or sometimes enlarged tonsils. Now determine the trend of the fever and cough during each episode. Okay, so now child is having a recurrent respiratory tract infection, isn't it? And we come to a hypothetical conclusion that it may be because of the bacterial infection, because of the presence of some of the background cause. Because child is having mouth breathing and snoring, that is because of adenoids. So adenoid is a background cause. Whenever there is adenoid is there, recurrent bacterial infections are also quite common. Okay, now we have to determine the trend of the fever and cough during each episode. He has got different episodes. So what is the trend in each episode? In each episode, mother is telling that both this fever and cough and nasal obstruction, what is there? So that will be relieved by the course of antibiotics. once you give the course of antibiotics, this will be relieved. Otherwise, it will not be relieved. So it is giving a good response for the antibiotics. So that clearly suggests that this is a case of a bacterial infection, and the cause for the bacterial infection is a background cause. A background cause like adenoids. It may be adenoids, it may be tonsils, sometimes it may be deviated nasal septum, or it may be some of the other congenital problems related to the respiratory tract system. Okay, or sometimes it is cardiovascular problems, congenital cardiac problems. So they're all considered as the background causes for this particular infection. So in this case, one thing is now clear: this particular fever is because of bacterial infection. It is not viral. This was also supported by some of the explanation given in the history. So child is irritative. That is, interfebrile period is not normal. Okay, child is not taking the feed. That means child is dull. So these are all, and the fever is gradually increasing. So this all suggests the bacterial origin of the fever. So at the end also it is proved that it is bacterial fever. Now, if you come to another part, family history is also there, isn't it? If you see, there's a family history of atopy is also there. Family history of atopy is also there. And one more thing is nasal obstruction is also there. Nasal obstruction is also there. So what you think about this now? So this is a combination of bacteria and allergic both. This is a combination of bacteria and allergic both. So this should be considered as an allergic rhinosinusitis. That means, why I am telling sinusitis? Because sinusitis is there because there is a nasal obstruction. That's also it is not mentioned. Of course, it is unilateral. Okay, so there is a bacterial infection is also there because of the background cause. Okay, so where the bacteria get localized here, the bacteria is localized in the sinus area. Okay, in the meantime, there is also history of allergy which further exaggerate this condition, leading to nasal obstruction and all those things. Okay, therefore fever and cough started at once. They both started altogether. So this is a case of allergic rhinosinusitis, if you want to talk very technically, with recurrent bacterial infection. Okay, so this is a combination of allergy and bacterial infection also. So this type of cases will be also there. Therefore, taking the history in a proper way is very, very important. Now, what do you consider Ayurveda in this case? How you will consider? So one is bacterial infection is there. In the meantime, there is also history of allergy. So this should be considered as either this fever should be considered as Sannipata Jwara, or we can consider this as Vata Pittaja Jwara, or it is this Kasa is nothing but Vata Pittaja Kasa, because we have got the symptoms of allergy and also we have got the symptoms of fever. Or this can be also considered as Pitta Kaphaja Jwara, because Kapha is also responsible for allergy at times. So anyway, okay, so as a fever is the main presenting feature here, so we need to go in line with the fever. So in the fever, it can be considered as Vata Pittaja Jwara or Vata Kapha Pittaja Jwara or Sannipata Jwara, and we have to see the severity of the patient and the symptomatology, and then we have to decide, and also we have to treat accordingly. Thank you very much. We will again meet with another case. So this is a very special case. So usually we will get, and there is a combination of three important things. What is happening here is one is combination of allergy, another one is combination of the background causes, another one is there is a bacterial infections. All these three coming together and they get localized. Sthana samshaya is taking place in the sinus area, and the disease, actually the bacterial infection localized in the sinusitis, that is sinus area. Okay, maybe sinus is having some narrowness or obstruction, something like that. Therefore bacteria is going and get localized there. Anyway, this is one of the very good case. Thank you very much for patience listening. Again, we will meet with another important case in coming classes. Thank you very much. Again, don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.